Good afternoon, and thank you so much for joining us on this Friday for this Coronavirus HQ update. I'm Jordan Fremstead. Starting off, here are the latest COVID-19 case numbers in Wisconsin. 21,926 positive cases are being reported at this time, and 682 people have died. However, more than 15,300 people have recovered, accounting for 70% of the cases reported in the state. 3 new cases are being reported in both La Crosse and Monroe counties, and there are 2 new cases in Trempealeau County. Another COVID-19 testing site is happening today in Crawford County. The drive-through testing will run until 6 o'clock at Prairie du Chien High School. Testing is open to people in Crawford County and surrounding communities that are experiencing symptoms. The free testing is being offered with the help of Wisconsin National Guard members. In Minnesota, nearly 29,800 people have tested positive and over 1,200 people have died. 1,015 of those deaths are people in long-term care or assisted living facilities. A little more than 25,000 people have now recovered from the virus. And in the state of Iowa, 23,166 people have tested positive for COVID-19, 642 people have died from the virus, and over 14,000 people have recovered. Studies conducted on COVID-19 patients have found that underlying health conditions can make the illness more severe if contracted. However, at least one common condition raises the risk of death from coronavirus. Mandy Gaither has more.
More than 100 million Americans have high blood pressure, according to the American Heart Association. And a recent study published in the European Heart Journal finds those patients also have twice the risk of dying from COVID-19. Researchers studied records of more than 2,800 patients treated in Wuhan, China. One of the study's lead authors says nearly half of the patients who died had high blood pressure, which was a much higher percentage compared to those who only had mild COVID-19 symptoms. The group also looked at high blood pressure medicines. Some doctors had feared ACE2 inhibitors and ARBs could make it easier for the virus to infect cells. But the study found the opposite. Based on their findings, researchers suggest patients not discontinue or change their usual antihypertensive treatment unless instructed by a doctor. They say it's important for those with high blood pressure to realize their increased risk, to take good care of themselves during this pandemic, and if they're infected with coronavirus, they may need more medical attention. For today's Health Minute, I'm Mandy Gaither.
And according to the CDC, there are several conditions that can increase the severity of coronavirus infections. That list includes people over 65 years old, anyone with chronic lung disease or moderate to severe asthma, those with serious heart conditions, and people who have compromised immune systems. We want to thank you so much for joining us for this coronavirus update, and we hope to see you tonight at 5, 6, and 10. Have a great weekend.